Economies crumble while the world tries to contain the coronavirus. As millions are forced to stay indoors to stop the spread, unemployment skyrockets. Is there a way to save lives as well as livelihoods? I'm Harin Contractor, and today on the Newsmakers, we look at the economic impact of COVID-19. If you thought the 2008 financial crash was bad, well, the IMF warns we're heading for an economic catastrophe that might be much worse. Since the outbreak began, millions have lost their jobs. Businesses have gone under, and the global economy is taking a hit at a pace not seen for decades. Even the world's most powerful nations have been forced to take drastic measures. The US and the UK have signed record-breaking stimulus packages, injecting huge amounts of money into their economies to help people pay their most basic bills. But how long can that go on for? Both nations are desperate to get their economies back up and running, which is almost impossible to do under lockdown. But with the coronavirus still spreading, it's not clear how much longer people must stay at home to save lives. What is clear, though, is that millions need to get back to work to survive. Is there a way to make that happen sooner rather than later? We'll discuss that in a moment, but first, this report by Harin Contractor.
Ordering people off the streets. Bolivia's military is enforcing a quarantine in the capital, La Paz. The Latin American country is following other governments by forcing people to stay at home to help contain the spread of COVID-19. That means many haven't been able to work. But the restrictions are worse for people that are self-employed. Mary Mamani is a taxi driver and hasn't worked for 2 weeks.
It is painful because you open your refrigerator and see it empty. Every day, the food runs out. As a mother, I don't know what I'm going to feed my son. What do we do? As a mother, I stop eating.
According to the International Monetary Fund, Bolivia has the largest informal economy in the world, with more than 62% of people self-employed. Millions around the globe share Mary's distress as their governments impose strict lockdowns. Without work, many people can't buy food, pay for their bills or housing. And most of those that are in the informal sector don't have pensions, sick leave or insurance. World leaders say the measures are necessary to save lives, but the cost has been unprecedented. In the last 2 weeks of March, the number of Americans that filed for unemployment rose to more than 10 million, the most claims in US history. Economists warn the jobless rate in the US could be worse than that of the 1930s Great Depression, and that collapse might be only months away.
Well, we're clearly living in something the likes of which we've never experienced in our lifetimes, and in some ways never in our history, because what's quite unique, and we're all living it every day, is that aspects of the economy have been brought to a stop.
Stock markets have tumbled to their lowest levels since 1987, and oil prices have fallen to around $20 a barrel, a value not seen since 2002. This is how the world's major cities now look, closed for business as governments desperately try to contain COVID-19. Several countries have announced financial packages to help struggling businesses and individual workers. But analysts warn this aid might not be enough to avoid a devastating recession. The Office for Economic Cooperation and Development says the world's economy could grow at its slowest rate since 2009. Restrictions are slowly being removed in China, where the novel coronavirus first emerged. China is the world's largest exporter and manufactures a third of the globe's goods. Could a recovery in Beijing be a sign that other economies can withstand the impact of COVID-19? Or will the effects of the outbreak be much longer lasting? Harin Contractor, The Newsmakers.
Well, as you saw from Harin's report, 10 million Americans filed for unemployment in just the past 2 weeks. But how much worse could it get? Well, to help answer that, I'm joined from Washington, D.C. by Harin Contractor. He served as an economic advisor to the former U.S. Labor Secretary during Obama's second term. And in New York is Roman Frydman. He's a professor of economics at New York University. Good to have you both on the program as we initially focus on the United States. Professor Frydman, first things first, has there been market failure, as they call it, if we look at the response to the coronavirus and the fact that you actually have a president and, for example, the governor of New York arguing and haggling over things like ventilators? So has there been a market failure?
Has been a, yes, indeed. The market failure actually precedes the crisis. The markets are notoriously bad in accumulating reserves that will be used for later use. That will be used later, and that's what happened in 2008, which is something we can get back to, and that's certainly what happened here, where our preparation for the pandemic, despite some warning signs from people like Bill Gates, has been insufficient and, in fact, dismantled completely at the beginning of the Trump administration. So, and now we have a clear case of not market failure, but misunderstanding of the relationship between the market and the state, where the market sort of that doesn't exist is being relied on in moving medical supplies to the most needed places and establish their price. The market, to begin with, did not exist for that, and that just leads to price gouging, and therefore I wouldn't call it market failure. I would call it the federal government failure to understand what the issues are, and unfortunately that spans the political spectrum from President Trump to the Democrats and Republicans.
Right, there's been a bit of a free-for-all. Harin Contractor, we know that in terms of our health, we're probably more vulnerable than we thought we were. Does that extend to the economy as well? Economically, has the United States proven here that it's more economically vulnerable than it projected itself to be?
Exactly right. The U.S. economy, even though it projected its lowest unemployment rate in 50 years, there are still many underlying weaknesses to the economy. For instance, a number of people who were employed prior to the recession did not come back. Our labor force participation never come back, despite all these notions of lowest unemployment rate for African Americans or Hispanic Americans. Their unemployment rates were still almost double than of white Americans, and wages were not rising the way it should have in a tight labor market. So there were already many underlying weaknesses, and the pandemic just kind of created a tipping point for some major issues that were being unearthed during this recovery.
Yeah, Roman Frydman, the question of the lockdown or ending the lockdown and opening up the economy again, that has also become politicized. So in a way, it's almost very difficult to strip away the politics and the name calling and look at what's best for the United States and the world. Is Trump right? Or is he maybe pushing too hard to reopen the economy? And is he gambling with people's lives at this point in time?
He, I believe, is really gambling with people's lives. And he's been doing this from the beginning of the crisis by delaying, by relying on the border closures with China, when it's now apparent that the way one can control the inflow is not through border walls, but through crossings, which he's completely neglected. So even the policy that he wanted to introduce, which made sense, restrict the inflow of individuals from potentially affected areas, has been hampered by the fixation on the border wall, as opposed to controlling the border crossings, which is the real way to control the inflow of people from the outside. And as reported, when it's now apparent, the inflow has been actually quite large, despite the boasting, which we hear daily about how this was such a wonderful policy. And not speaking of the fact that the delays that many of the governments are maybe have a problem with, in fact, including probably the Turkish government, although no one knows, given the way in which the rates of the cases are moving now, it's extremely dangerous. So I would say this: gambling with people's lives, yes, being extremely irresponsible in terms of not just lives, but the economy, because the crisis is a crisis is a healthcare crisis, and therefore people returning to work too early will just exacerbate both the health crisis and the economic crisis.
Right. Harin Contractor, can you actually split the difference or find some sort of compromise? Can you actually do both at the same time, keep people safe and healthy, but also get a certain amount of people returning back to work? Can you actually do that?
Potentially you could, but to touch on the professor's point, I kind of disagree in a couple of marks here. There was a massive failure on the federal effort, but none of it, most of it stemmed from closing down the borders. It was ramping up production in order to contain the virus. The United States and South Korea they had their first positive case on the same day. And we see what's going on in South Korea, where they were literally about to reopen society, go back to school, start their factories, have a fraction amount of cases and a minuscule amount of death compared to what the United States is going through. There are even countries in Europe that did not shut down their borders that have fewer cases than the United States in terms of per capita. So there was a massive failure not only to recognize the issue, but the White House was speaking of both minds where they were saying, this is a threat, we need to be mindful, we need to shut down the border. But then they called it a hoax. And they also talked about buying stocks in the middle of February. We had our Commerce Secretary saying this would be great for U.S. manufacturing. So when you have all these contradictions coming out from the White House, it's hard to lead. It's not the job of governors or states to understand international intelligence. That's from the leadership.
Right.
And so now, in order to restore the economy, we must need to ramp up production of testing to make it vibrant, to make it accessible so we can identify these clusters and isolate them in order to bring people back. And that did not happen in the United States. The president has the authority to create mandates for the private sector to start producing masks, protective gear, testing, vaccinations, but that is not happening today.
Right. And as was mentioned, we're seeing price gouging. Come in, Professor. Yeah.
If you allow me. First of all, I, of course, agree 100% with Harin. And I meant that even what with the signature wrong policy of the president was also bungled up. That's all I meant.
Right.
Of course, we have to ramp up production. And the next question is the question, how we using the supposed stimulus.
Right.
We have not used the stimulus to ramp up production. The only thing that was done reluctantly is the Military Production Act, where obviously we can exchange the money that the corporations receive for the stimulus for them to repurpose the production of medical equipment, something that I've recently advocated with Ned Phelps. And that's necessary. And that's not being done purely for ideological reasons, because the state is not supposed to tell the corporations what to produce, as if we were not in dire danger. So there's some really serious obstacles. I completely agree. We have to immediately ramp up production, and the stimulus should be used to there should be no long guarantees without pledges of repurposing to produce medical equipment.
Okay.
And
right.
that is not happening.
Right. Yeah. So you're hanging a question mark over that more than $2 trillion, the stimulus money, whether it's being best utilized. Harin, I wonder what your thoughts are about that, because one argument is that, well, there might be a recession now, there might be all this economic pain, and if the stimulus money is not used properly, that money also goes and adds to the load of the long-term debt, and future generations have to pay that back at some point. So do you believe that the stimulus money is being correctly utilized right now, Harin?
It is a Band-Aid. I think the House Democrats did a good job of straightening safety net protections in terms of unemployment insurance and providing cash in people's hands that need it. Unfortunately, we can't really implement the full amount of the stimulus, as the professor mentioned, until we start slowly ramping back up. And that was a massive failure. There's probably going to be another phase of stimulus, and that one really needs to focus on addressing these massive structural barriers that have been built up in this country over decades that exacerbated inequalities, and get people into production, into revamping the way we do work in America. Right now, we have millions of students who are sitting at home trying to do coursework through the internet. A significant amount of don't even have internet at home. Another portion don't even have computers at home. There's a massive skills erosion that's going to happen over the next 6 months. How do we boost those people back into skills and jobs? The people who lose jobs, what are we going to do to ramp them back up? We need to create massive public works pipeline to at least help us bridge this gap. We failed to do that in 2008 and 2009 because of ideological concerns from the Republicans who balked at President Obama for doing a massive stimulus. They wouldn't allow him to get $1 trillion stimulus, and they didn't blink an eye when President Trump asked for a $2 trillion stimulus.
Right.
And so there's some ideological differences here. We need to put that aside and do what's best for the American people, not only for the American people, but for the globe entirely. Because if we don't ramp up manufacturing of protective equipment and potential vaccines, how are we going to get the world back online, which supports all of us?
Final question for you, Professor Roman Frydman. Following, if you'll allow, your response can be, certainly you can, okay, can you fold in your response to this final question? Because I wonder, you've been around for longer than most of us, and following your career, you've seen nations rise and fall from Eastern Europe to elsewhere. People using the word depression. They talk of the fear of another depression. Is that plausible? Is that possible, Professor?
Can I relate it to your excellent previous question?
Sure.
And here I will disagree rather strongly with my wonderful colleague here. I think that the stimulus is just, on the whole, the way the money is allocated is a disaster. That's what I say. So let me now briefly explain what the stimulus is doing. So the stimulus, for example, allocates $500 billion to the corporate sector without any restrictions on the layoffs. So just imagine, just to be very simple for your readers, just imagine what is going on here. So my colleague here on the panel said that, wonderful unemployment is being prepared, and there's a net and all that stuff. So just imagine what we're doing here. We have a situation in which we give money to the corporate sector, which is neither used to support the effort against the coronavirus, which is the main focus, nor used to maintain the labor force so it can quickly return after we finally get the virus under control. So let me be very specific. If you give money to the corporate sector that is not required to maintain the labor, as the Germans and the Danes, and actually independently of ideological spectrum, and Boris Johnson has done, so this is not a matter of left and right, then what happens next is exactly what happened in the United States. People are released at the rates that your wonderful correspondent reported at the beginning, namely at the alarming rates that St. Louis expects the unemployment rate to move above the Great Depression. So what basically happens is that the stimulus program is a program to create unemployment. That's basically what the program does. And then it creates unemployment and allocates another $260 billion to pay unemployment benefits. The next idea on the program is the additional stimulus proposed by the Speaker Pelosi and warmly supported by the president, that we're now going to spend another trillion or $2 trillion for public works programs. But who has ever heard of public works programs when people are locked down, they're going to be building highways? At least what Harin said is sensible, that they could be eventually, maybe we could equip them with computers. This is not the time now. Now we have to save the economy and save our lives. And therefore the firms should not be allowed to lay off people, and they should only get the guarantees if they maintain people, and then they should repurpose their production. It's been done elsewhere. It can be done in the United States. Which is why a lot of the
stimulus around the small business was for the payroll protection program. But I completely agree on the $500 corporate bailout. There was supposed to be strict oversight on that, but it looks like the president's going to be ignoring that oversight mechanism as well, which was very concerning.
It's not a matter of oversight. It's not a matter of oversight. It's a matter of complete misdesign of the program. Oversight is a secondary matter. We're not talking now about correcting for 2008 stock buybacks, dividends, and all that stuff. This is not a program that is geared to the task at hand, except for $360 billion for small business. One could quibble whether it should be means tested or not. The rest of the program is basically the program in which one creates unemployment and then one pays for it without getting anything in return in terms of ramping up production. And note, for example, we miss equipment in New York. So what do? We have equipment in Wyoming, which is a very low intensity area. Why shouldn't Delta Airlines, in return for the help for the airlines, be transporting equipment from Wyoming to New York and back? The French are using their train system to transport sick patients from Paris to Brittany. This is not the rocket science.
The major issue there is, again, failure of leadership to try to coordinate
Professor Frydman and Harin, listen, I've got to move on to the UK. This has been fantastic. I've actually asked for an extra 2 minutes on the program because I feel it's so important to have listened to, especially Professor Frydman's analysis at the end there. Gentlemen, it's been a pleasure having you both on the Newsmakers. I thank you very much for joining us. I mean, once again, we're sitting here, we're looking at people saying we need to open up the economy in order to survive. But on the other hand, people saying, well, there won't be much of an economy left if hundreds of thousands of people are dead and millions of people are hospitalized. It's a big decision and a big discussion. And as we heard from Professor Frydman, he's saying that more than $2 trillion injected into the US economy is not being used properly. Now let's have a look at how the coronavirus is affecting the US, beyond the US, the world beyond the US, and let's look at the economic impact in the UK. About 8% of workers in Britain have lost their jobs since the outbreak. Will that number rise even more? Well, to discuss it, I'm joined now from London by George Batchelor. He's the co-founder and director of Edge Health, which helps health organizations be more efficient by using economics. And Mike Galsworthy is a visiting researcher at the London School of Hygiene and Tropical Medicine. Good to have you both on the program. It comes at a time, we talk about the UK economy and the UK tackling coronavirus at a time in which the Prime Minister is hospitalized for coronavirus as well. So extra anxiety. Mike Galsworthy, how has the UK managed, and can the economy take this strain?
That is a tricky question. I mean, we're going to wait and see because obviously the situation is unprecedented. The UK was a lot slower than many other European countries or Asian countries to lock down when the problem came along. There was confusion over what model we were following and why, but then when the model informing the government revealed that if we were to stay on our current course, that could be 250,000 people dead because our intensive care units would be flooded, the government dramatically changed course and decided to start doing the social distancing, and then shortly after the school lockdowns and so forth and so on. With regard to buffering against job losses, you just heard from the States where there has been nothing really put in place to stop companies laying off their staff. What has happened in the UK is quite quickly after promising funds for companies, the government realized that they would be laying off staff. So what you have to do is you have to offer that those companies can keep on those staff, and the government itself would pay for 80% of their wages. Then there was an issue with self-employed people, and again there are mechanisms put in place to cover 80% of their wages, because really what you want to make sure is that everyone in the economy actually has enough finances to keep surviving. So, but the next step will be trying to actually get those people back to work, so that it's not the government paying for them directly, but actually their jobs again paying for them directly.
George Batchelor, similar to the US, people itching to open up the economy again because this is costing the economy billions every day. But the reality is countries shouldn't be opening up right now because the virus is way too strong. So how much longer can the UK continue to absorb the losses? And can it actually, as I asked about the US, split the difference and have the best of both worlds?
So I think at the moment what we've seen is that the UK had to protect the situation around the NHS, the health service, and effectively to stop people dying in the way, as Mike just mentioned. I think the way forward from here is quite a tricky one. there are a number of extremes that we could look at to think about what option there are. One option is the sort of very controlled approach that they've taken in Asia, in countries like Singapore and perhaps China, where they've basically reduced the spread of the disease to the extent that they can now start allowing bits to open up and very carefully monitor if the disease comes back, and if it does come back, take some corrective actions. I think at the other extreme, you have countries like the US and also like Sweden, where they haven't put in such strong measures, but are trying to sort of limit the impact that the disease might have on the health service.
Right.
I think the UK is probably going to try and find something somewhere in the middle of those two extremes.
Mike Galsworthy, okay, Mike Galsworthy, can the UK actually do that? Can it find that middle road?
Well, that's what everyone is struggling to achieve. I would phrase it slightly differently in terms of, instead of thinking of a trade-off, think about it in terms of a choreography. In the first phase, you don't know what the disease is going to be like, but you're sure as hell worried about the bandwidth of your hospitals and particularly critical care units. So a lockdown buys you time to see what's going on and buys you time to ramp up the bandwidth on your critical care units. However, as we were just saying before, you then have to be paying for the economy to be in hold pattern. And so you want to be getting the economy reinvigorated as you're watching what's going on within your own country and from other countries.
Okay, Mike, I'm going to jump in.
That's where you need all that testing in order to see who can go back and who can't.
I've got 20 seconds left on the program. My apologies. I went too long on the previous segment. So George Batchelor, in 15 seconds, wrap us up. Can the UK do that choreography?
I think it's a case of getting a lot of testing done, having some way of tracking the spread of the virus, and looking at how we can manage it when and if it does start to come back after the lockdown is lifted. I'm optimistic.
George and Mike, thanks so much for joining us here on the Newsmakers. And thank you for watching. We will see you next time. Bye-bye.